Hi, my name's Justin, and I selected the Beck scale for suicide ideation created by Aaron T. Beck, MD. The purpose of the test is basically an evaluation of suicidal thinking that helps identify individuals at risk. It also helps measure a broad spectrum of attitudes and behaviors. And the Beck scale for suicidal ideation, or BSS, measures attitudes and behaviors that clinicians routinely consider when assessing a patient's suicide risk. In terms of a brief overview, the age range is 17 years and older. Publicized in 1991. Qualification level is a B level. Completion time is 5 to 10 minutes only. Scoring options are manual scoring or Q Global scoring and reporting. It's publicized in English as well as in Spanish. Some of the benefits are that it can reveal specific suicidal characteristics that require greater clinical scrutiny. And there are 5 screening items that reduce the length and intrusiveness of the questionnaire for patients who are non-suicidal. The full scale itself consists of 21 test items. In terms of the reliability and validity, I looked at a couple of studies. One was done by Hawley, Pelkonen, and Carlson in 2005, and they looked at the psychometric properties of the BSS for adolescents, actually. The Cronbach alpha for the whole the scale and the assessment instrument was 0.95, which is obviously high. The total score differentiated patients and controls and increased statistically significantly in classes with increasing severity of suicidality derived from suicidality items of the K-SADS PL diagnostic interview. The area under the receiver operating characteristic, or ROC curve, was 0.84. It was thought to be 75% sensitive and 88.9% specific for the population of adolescents studied. And the conclusion of the authors was that the instrument appears to be reliable and a valid measure of suicidal ideation for depressed adolescents, which is interesting. The study claims to be specifically for 17-year-olds and older. The second study was actually a study from Iran, which is interesting, from 2015. Esfahani and Yashemi and Alavi took a look at the psychometric assessment of the Beck scale for suicidal ideation in the general population in Tehran. The Cronbach alpha's coefficients for their study were satisfactory of greater than 0.8. And both the screening part and the total scale had a positive correlation with depression and global severity index in SCL 90R, and had a negative correlation with social support, which fits. The scores of the screening part had a positive correlation with anxiety, psychotism, and hostility and hopelessness as well. Their conclusion was that the Persian translation of the BSSI had desirable psychometric properties in research settings. However, the clinical usage of the scale remains to be explored. It's interesting that the Beck scale can actually be used in telepractice. And I think often when we think of suicidality, we think of it in a clinic setting on a one-on-one basis, but it's interesting that it can be used through telepractice. It's recommended that the professional should follow best practice recommendations, following appropriate ethical codes, telepractice regulations, legal requirements, and so forth. It also recommends that professionals should use their clinical judgment to determine if telepractice is really appropriate for this type of situation. The BSS Q Global Starter Kit, which includes a manual, which is digital, and 5 Q Global administrations and interpretive reports, costs $98.40. And the BSS Complete Kit, which includes the manual and 25 record forms, costs $146.10. I had a couple of interests. One was the norming population used by the test designer. It wasn't actually available on the Pearson site. I also wondered why they chose to sell the test to be used for clients 17 years and older. And how did the test designer describe the reliability and the reliability and validity specifically? That information wasn't openly available on the specific site. My references include Butcher, Perry, and Hahn, 2004, Computers and Clinical Assessment, Historical Developments, Present Status and Future Challenges in the Journal of Clinical Psychology, and then of course the 2 studies that I referenced earlier regarding the psychometric properties of the validity and reliability for the BSS. Thanks very much.